I am so excited about the prospect of solving one of our biggest problems. I want to ask you a question. How many of you know someone who does not have any health insurance? They are uninsured. Well, that's a pretty big number. How many of you know somebody who has insurance except the insurance company won't pay the bills? You see, we got two big problems. We talk a lot about the 47 million uninsured Americans, and that to me is a moral outrage. That in America today, people literally are sick and dying because they don't have health insurance. But the other big problem are people with insurance, except the insurance companies always say no. You know, their doctor no. I've met so many people who have told me their stories about needing an operation or needing a certain drug or needing a therapy, and the insurance company won't do it. So here's what I say we do. If you're happy with your insurance, and some people are, nothing changes. You keep exactly what you have. But if you're not, then we're going to open up the congressional plan to every American. Congress has a good plan for itself. And for federal employees, more than 250 choices, and we're going to let you and your families choose because everybody's different. You know, some families you have diabetes or cancer or some other chronic condition. So we're going to let you choose, and if you don't have all the money you need, we're going to give you health care tax credits, and we are going to limit the amount of money you have to spend ever on the premium for insurance. So it's going to be affordable for everybody, no matter what the income of your family. And we're going to start covering mental health because it is not right that mental health doesn't get the care that it deserves to have. And we're going to cover prevention because it would be a whole lot better to prevent illness instead of treating it after it already happened. Now, this is one of the big differences between Senator Obama and me because I think everybody should have health insurance. I don't want to leave anybody out, not a single man, woman, or child. Everybody should have health insurance. And we can make it affordable to do that. And I believe that we're going to get it done because it is time. Doctors and nurses, businesses and labor, individuals of every background in our country know we have to change. We spend so much money and we leave so many people out. And we have so many people denied care. And I know that if I had the time, I would hear stories like this from all of you. You know, I met a man the other day. He was diagnosed with prostate cancer. And the next month, his insurance company canceled his policy. He has 2 daughters. He had saved $50,000 so he could help send his children to school. Now he has no insurance, so in order to have his surgery, he'd have to use his entire life savings. I think that's wrong. Or the woman that I met who has breast cancer, and she got her insurance through her job, but the treatment made her so sick she had to stop working. She finally got well enough, but the job said, we're not going to take you back. So she lost her job and her insurance. So I don't want to leave anybody out. And I think if we all agree, if we are determined to do what we need to do to get everyone affordable health insurance, I think we can beat the insurance companies and the drug companies and make it happen.